Hi, my name is Abby Billig, and today the purpose of this video is to explain how I met all of the objectives in Nursing 335, Leadership in Nursing, this spring. So course objective number 1 is to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing in meeting the multidimensional needs of individuals and groups within the local geographic area. So I felt like I was really able to do this. First, with my community wellness post, I did about reducing stress, especially during these times with COVID and work and school, and especially finals week. It's really important for people to find ways to de-stress and how stress can affect their health. So I felt like I was able to pull in like aspects of psychology and all the other classes I had taken, because we know that stress can have a really big impact on the body, especially psychologically. And then as we learn throughout nursing school, that stress can also help and like make the disease continue longer than it needs to. I also felt like I was able to meet this objective with my peer leadership hours, going to the clinical, and when students had questions, being able to answer them, being able to help them with questions that they had about the class. I went to 320 and 321, so being able to share my knowledge when they had questions was really helpful and interesting. And then also I was able to help them write their notes and give them some feedback. Objective number 2 is to apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. So I felt like a lot of this had to do with the classwork actually, and being able to, again, review the ANA Code of Ethics and how that applies to just daily care for patients. You want to do no harm really, and also being able to review certain ethical cases that you wouldn't think would be able to happen, like I did baby K in my group, and the mom just wanted her alive on a ventilator, and it's interesting to see those things happen so that there's a standard of how that would be handled again. And also I felt like my service leadership really helped with this one, Feed the Children. A lot of ethics starts with, being able to help people, and is it wrong to do this? So wrong or right, depending, and I feel like that's sometimes a big issue with like people who don't have insurance and healthcare, and why it wasn't that big of a scope. Being able to, help families get the things that they need, I feel like just made me reflect on being able to meet the needs of these families that need help with things like food and hygiene products. Number 3 is to evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So I felt like I met this through my patient logistics, just because it's kind of important for the people in patient logistics to know where to put a patient. Like you wouldn't want to put a GI patient on a cardiac floor just because the cardiac nurses are going to know what to do more so with a cardiac because they're used to that specialty. And you want the patient to get the best care and have kind of that just like constant as they would on, like, if they had a GI problem, if they can be on a GI floor, so that they get that constant and like that very standardized care, because all the nurses are used to that. Also, listening to OT, which was our interprofessional, having them talk about how they work with nurses and how they have to all work together, because say the nurses catch something that OT doesn't, they spread the information, and they can all work together to get the best health outcome for that patient. So just a lot of really the interprofessional hours, because everybody's all working together to kind of give the best care for that patient, and not everybody has eyes everywhere, so it's very important to kind of share that information with everybody. Number 4 is to critically analyze and integrate leadership research findings into the total plan of care for a selective group of patients and their families. So again, I kind of tie this back with the nurse practitioner students and their projects, being able to share how, and like going on their websites and seeing how this research that they're doing can help benefit patients. So I kind of tied that in again with my interprofessional hours, is kind of like all medical things are based off research, so just being able to share that information and grow as a medical industry. I also put patient logistics again, just because of where they like the need to place patients again, and also being able to learn about the COVID-19 vaccine, rollout through LVHN and how they plan on doing that and educating people, and how they're constantly not changing the information, but updating the information based off research. So number 5 was to apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. Again, I tied this back to my interprofessional hours and my advanced practice because education is very important in the nursing field and in healthcare. So I think it's really important to have OT teaching patients how to walk around at home, and also working with the nurse and making sure they know how to properly walk, like specific person to person, walk somebody, keep them updated. Also being able to hear from Dr. Pasquale and how she got involved in research and how her different research is able to affect the patient, and how during her research she had to advocate to have families in the room during things like CPR just to kind of see if that would affect the patient. And then Professor Frechtel and how she spoke about being like a bedside patient educator. I think it's really important. I feel like when we're in clinical in the hospital, we don't really get to interact with the patient educator, like the diabetes educator. So I think it's really interesting to hear firsthand from them how they go about educating not only the patient, but also the nurses, and being able to share that information with different policies and all of that. Number 6 is formulate plans for continued personal leadership growth and development as an independent practitioner of nursing. I tied this back to really the continuing education piece, because I think it's important to grow as a nurse. So things that I did in this aspect were the NRCLV symposium, where they kind of brought back graduate nurses and they were able to tell us their experience as nurses during the COVID-19 pandemic, and how it's important that like things are always changing, and to always, they say that like things are not really normal for where they were, considering most of them graduated into working in the pandemic. So I think it was just interesting on how they all spoke about being able to adapt and like always being open to grow as a nurse. Also, there was a podcast based on substance abuse, and I think it's really interesting how a lot of the time the issues with substance abuse, people who do suffer from substance abuse disorder, they're seen not as long as like nurses want to be unbiased. Sometimes they are, and I feel like that has a really big effect. And it was really interesting to hear how these people who were patients who were telling their stories were speaking about how they were some were like not forced, but like really pushed to enter rehabs, and how that saved their life, and how nurses really changed their perspective, and like they felt like they were actually cared for and not just somebody suffering from substance use disorder in the hospital. And also bias training. This was through the March of Dimes, which has a lot to do with preemie babies and everything. So it was just really interesting to hear from those different perspectives on how women of different ethnicities can be seen in the healthcare system, and how even though a lot of nurses really want to have that unbiased, there is still that like ingrained bias, and how we can all work a little harder to kind of just get rid of the bias and make sure we are actually taking care of people equally. So I think it's really important to always have those kind of open, or like open-mindedness to help all these different kind of patients that we'll see in nursing. Number 7 is recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. So number 7, I really feel, was mostly my political hours. So we got to hear from a lot of different individuals at different levels of politics. So it was just really interesting to hear how their work has been affected by COVID-19, how policies are affected by COVID-19, how I remember DeRosa talked about how she used to get calls about like potholes, and now it's really how people they want to get vaccinated, and a lot of it is older individuals who do not have access to the internet to make appointments, which is great for a lot of people, but the older generations, and how this has affected a lot of different policies. And Dr. Seaman even uploaded a document. So it's really interesting to see things like the Nurse Licensure Compact, which would make it easier for nurses to get their license in different states. The Patient Safety Act, which also talks about how nurses are suffering from understaffing due to the COVID pandemic and how they are really suffering. And it was just really interesting because you always think of like the care of the patient, but also in the Code of Ethics, it talks about how nurses should be caring for themselves as they are for patients. And sadly, because of COVID-19, not many people are doing that, and they're kind of suffering mentally and physically because they're taking home that burden. So I think it was just really interesting for these different policies to be included for us to look at, and the Patient Safety Act was one that really like stuck with me. But overall, just being able to hear about how COVID has changed so many aspects of politics that I wouldn't really think of as just a nursing student. And number 8 is being able to predict and describe potential ethical dilemmas within clinical organizations and professional nursing practice. So again, I felt like this was really embodied during the actual class, being able to learn about all of these different things, and especially utilizing the ANA for all of our projects. I felt like this was also, again, led through my service leadership, because I think it's important to recognize that people need these things, these like certain aspects to survive, and it's just a hot topic for some people. And I also feel like my ethical article that I had to look up, and just kind of looking about how nursing management can be affected in ethical ways on the unit. But those are my things. I pretty much, as sources, I looked at the ANA Code of Ethics, and then I was able to again look at the different policies, and I felt that I had met all my clinical hours, especially in a very interesting way, considering I know in the past they've been able to physically go out and do a lot more, but I also think it was nice to be able to have this opportunity to get different experiences through Teams meetings and talk to people that we might not be able to interact with if we went in person, and kind of kept that same flow. But yes, so thank you for listening and have a good night.